Ladies and gentlemen, dental health is a topic that impacts each and every one of us. And today we are here to take a deep dive into the fascinating world of dentistry. I'm Lynn Alexander, your host for this new and current live show. We have an exciting lineup of discussions with our own dental expert and key opinion leader ready to share his knowledge and insights on the trends, the best practices, and affordable treatment options in the field of dentistry. Whether you're a seasoned professional or someone simply interested in maintaining a healthy smile, this show has something for everyone. Throughout our time together, we'll explore a wide range of topics from the importance of oral hygiene and prevention care to the latest advancements in dental technology and techniques. We have already received several questions from our loyal followers and we will be answering. We'll also have an interactive Q&A and we encourage you to send your questions and comments. With no further delay, let me introduce you to our very own dental expert, Dr. Kumar Vadivel, DDS, MS, MBA, FDSRCS, fondly known as Dr. V, who is a board-certified periodontist and a fellow of the Royal College of Surgeons of England and Scotland. Dr. Vadivel specializes in offering periodontal, implant, and oral surgical care to his patients through our ToothHQ specialists dental offices located throughout the Dallas-Fort Worth Metroplex in Texas, USA. Dr. Vadivel is also the proud author of his upcoming book, slated for release in 2024. To know more about Dr. Vadivel, visit our website at www.mytoothhq.com. So sit back and get ready to embark on a journey into the world of dental excellence. Without further ado, let's kick off this innovative and engaging dental live show. Welcome, everyone. It is my honor to welcome Dr. V again, and let's get started.
Well, thank you, Miss Lynn, and thank you all, and hello again, and welcome to our new and the current episode of the Dental Dilemmas. We are so happy to be here again, and for those who are watching this show tonight, I welcome you all to spread the word around and help the community as we do, and you have the responsibility to help the community as well. So give us a thumbs up, like us, follow us, share it to other people, and we would love for you to help the community as well. And let's get started.
All right. So I have some great questions here today. So from one of our listeners, they're saying, I've received a diagnosis of hypoglycemia, which led to the necessity of undergoing a procedure to remove one of my parathyroid glands. I've also been experiencing severe dental problems that no one seems willing to assist me with. What steps should I take in this situation?
So what this caller is saying is they have some kind of a mineral deficiency, hypocalcemia, or any type of hypothyroid issues may lead to some kind of a mineral deficiency, which may end up ultimately affecting your teeth. And of course, without looking at your teeth, and I wish I could diagnose over the phone here or diagnose over the internet. I don't have the ability to do so because we have not seen your teeth. I can only assume that you do have some kind of a mineral deficiency. So depending on the mineral deficiency you may have, it may be as simple as you may need some kind of a fluoride treatment, or you may have some simple cavity starting which may just need some fillings, or if you have severe mineral deficiency, you may need some kind of a veneers, or you may even need some crowns, dental crowns. So my recommendation is you go visit with your local dentist, and I'm sure wherever you are, whichever part of the world you are, they should be able to help you with the multiple treatment options the technology has to offer and your dentist has to offer. And I wish you all the very best.
Wonderful. Thank you for letting everybody know how to go to find their dentist and talk to them about these problems. The next question is, I'm interested in dental implants. Could you please explain the steps involved in getting them?
So what they are asking, what this viewer is asking is, what are the steps involved in the dental implants, and could you explain the steps involved in getting them? Of course, all the viewers, again, I want to apologize to you guys. I won't be able to diagnose over on the internet, or I won't be able to diagnose over the phone. Um, so the steps involved is, first thing, of course, is anytime you go to a dentist, and the first thing that they are going to do is what we call it as a clinical exam, which means that we are going to look in the mouth and see how much of bone you have, how much of gum tissue you have, and whether your health is going to allow, or how can we make your health allow to for you to receive the dental implants. That's a clinical exam that we are going to do. And after that, most dentists are going to do what we call it as a CAT scan or a CBCT scan of the mouth and the jawbone, to look at the teeth as well as the surrounding bone. Once they do that, and they are going to put the two and two together along with the radiology or the CAT scan exam and the clinical exam and your health history exam, they should be able to give you the plan of what is involved in the placing the dental implant. So once you receive, and once the dentist or the surgeon makes sure that you are a good candidate for dental implant, and they are going to explain to you what the steps involved in getting the implant, which is usually the first step is what we call it as a surgical step, which is placing the dental implant, and you allow for the bone to heal around the implant, which usually takes like about 2.5 to 3 months, and then after that you're going to receive a tooth and you're pretty much done. That's the initial part. After that, it's just a matter of maintaining the dental implant, and that it could be as easy as just going to the dentist and just get it done.
That's right. Just go Nike.
There we go. That's what we say. We say, go Nike, just do it, right? Go see the dentist.
All right. So our next caller is wanting to know about extractions and nerve damage. So they're saying that they've had some scans that are not indicating any problems, but they are experiencing a burning sensation in their palate, tongue, throat, and lips, where they can't even speak. What do you? They're asking what you think could be the issue.
So what this caller is saying is they had some kind of an extraction done, and they possibly think there is some kind of a nerve damage, and they are experiencing this burning sensation in the palate, which is the roof of the mouth, and the tongue, and the throat, and also the lips, and they are not even able to speak. Normally, anytime you do have some kind of a nerve damage, particularly that is related to the dental extractions, it is usually not related to not being able to speak. So I really can't tell you why you're not able to speak. So definitely I recommend you check with your dentist or the surgeon, whoever did the procedure. But going back to, if you're experiencing any type of abnormal sensation, including any type of numbness on your palate or the tongue or the chin or the lip, and that is usually, it is very possible it could be related to, and I'm hoping that your dentist or the surgeon, whoever did the procedure, was able to discuss the any type of risk and complication associated with the dental extraction. And if it is immediately following the extraction, we do have a variety of treatment that we deliver to our patients. For example, we recommend you take certain vitamins, and then you take certain steroids, and after you do this for a shorter period of time, which is usually about 4 to 6 weeks period of time, and if you're still experiencing that type of nerve damage, which is the numbness that you are experiencing, we recommend you go see a neurologist or a micro neurosurgeon. In my case, I do plenty of extractions, and this is what I do for a living. And I'm not going to say that, oh, my patients never experience nerve damage. Of course they do. and whenever they have experienced and because of the risk and complications associated with the extraction, we normally recommend they go see the neurologist or the microneurosurgeon. So going back to your question, and if you are going to end up seeing the neurologist or the microneurosurgeon, they are going to do a variety of procedures, including an MRI scan, or there is another procedure called microneurography. They are going to do all of those things, and they should be able to determine whether you are a candidate for or any type of micro nerve repair after doing the MRI scan. So again, um, my short answer to your question is there are some investigations that can be done to truly determine whether there is any type of nerve damage, such as MRI scans that can be done. Once the scan shows whether there is any type of damage or not, the neurologist or the microneurosurgeon that you are going to see, then they should be able to tell you what can be done to help you with the problems that you are experiencing.
All right. Thank you so much. That was a wonderful answer to a question that a lot of people don't really know about. So,
Absolutely, yeah.
all right. So, our next listener is wanting to, let's see, is it possible to perform oral surgery involving bone grafting on both the upper and lower jaws? I have multiple abscesses, sinus issues, and severe lack of jawbone on both my upper and lower jaws. I'm feeling extremely desperate.
So what this caller is asking is, so they have extreme bone loss and they want to know it is possible to have any type of oral surgery involving any type of bone grafting, or whether they are a candidate for receiving dental implants. And I'm going to say a simple answer is almost everything is possible. So with the technology that we have nowadays, we do a multiple type of implants. In about 10-15 years ago, um, this technology, although was there, it was not popular. For example, for somebody who has completely lost the bone on the upper jaw, and 10 or 15 years ago, what we call it as a zygomatic implants, they were not as popular. And we call it as a pterygoid implants. Those things were not popular. So now, with the advent of technology, we are able to offer for somebody who doesn't have bone on the back, we do what we call it as an all-on four implant, where we place just four implants just in the front to be able to reconstruct the complete upper jaw. For those who don't have a bone almost pretty much anywhere, what we call it as a severe or advanced alveolar atrophy. So we are able to offer implants using what we call it as a zygomatic implants, where we place implants inside the cheekbone, almost into the cheekbone, to be able to give the prosthesis. For somebody who even have even more advanced, when they are not a candidate for zygomatic implant, we even place right in the back, inside the jawbone, in the back, right there, we place what we call it as pterygoid implants. It could be a combination of zygomatic and pterygoid, or it could be a combination of a couple of implants in the front, along with zygomatic, along with the pterygoid implant. So, to answer your question, absolutely, oral surgery is possible. Absolutely, the bone grafting is possible if required. Absolutely, the dental implants are possible. Pretty much the bottom line is we can give you your teeth back, we can give you your life back using dental implants. That is related to the top jaw, which is the upper jaw. Even on the bottom jaw, again, there are multiple options available. When you have severe atrophy, we use what we call it as a shorter implants, or like a smaller implants in the back, where you may have closer the bone erosion closer to the bone. And even on the front of the jawbone here, we can use even thinner implants. And so again, my short answer is go see your dentist and go see the surgeon who may be specializing in these type of zygomatic implants in your area, and they should be able to help you. And of course, if you happen to be in the Dallas Fort Worth area, come see us at ToothHQ and we can definitely help you as well.
Well, thank you, Dr. Vadivel. Um, so it sounds like what you were saying is that no matter the situation, there's typically, for most any situation, a way to help somebody replace the teeth that they've been missing, no matter what is going on. And usually we can find an affordable way to help them fit it into a budget for themselves.
Absolutely, absolutely correct. Yeah, we can find the right procedure, we can find the right budget, and then we can definitely help almost every single one, like Lynn said, and your dentist should be able to answer that for you.
Thank you. All right. So the next one that has written in is a 13-year-old and they still have primary teeth. Is this common?
So the next caller is asking, I am 13 years old and I still have primary teeth, and is this common? Absolutely, it is common. Whether you're 13 years old or you're 30 years old, 30, or you're 80 years old, it doesn't matter. So you can still have primary teeth, and we call it as a retained primary teeth or retained baby teeth. Sometimes I see patients, who are, like I said, 80 years old and they still have a baby tooth, and as long as they are stuck solid in the mouth, and we just kind of pretty much leave them. And of course, with the advent of dental technology, whether you're 13 years old or 30 years old or you're 80 years old, if you still happen to have a primary tooth or a baby tooth, and if you end up losing it for any reason, we can always replace them with the dental implant.
Thank you. All right. So our next caller is asking, it is important for me to explore my options for financing a full dental implant. Can you provide information on whether Medicaid or any other dental insurance plan might help with the expenses?
So, what this caller is asking is, this caller needs a dental implant and they want to know the expenses involved in the dental implant, and whether if a Medicaid plan would help with the dental implant or any other dental insurance plan can help with the dental implant. So, if you do not have insurance and if you are thinking about getting insurance, my recommendation is, whichever agent that you are talking to, talk to them and then see whether the plan that you are going to get and is going to help you receive a dental implant. You can give them even the codes, what we call it as a CDT codes, or the dental codes. You can get it from your local dentist and you can check with your agent whether that is going to be covered. And the most common thing people forget, whenever, particularly if you are going to get a private insurance, which means like you do not work for somebody and you do not work for a company, you do not work for a corporation, then you are going to get a private dental plan. There are always going to be waiting periods, and there is always going to be what we call it as a missing tooth clause. So if you happen to miss a tooth prior to getting the procedure, prior to getting the plan, they are going to deny it under the plan. It's almost like a pre-existing conditions, what we call it as in the medical world. So you're not going to receive the dental implant under the plan. So the short answer is, check with your agent whether they are going to cover the dental implant, uh, and not going to deny it as a pre-existing condition or under the missing tooth clause, and whether they are going to still give you the dental implant without any type of waiting period, and whether they are going to cover it. That is one. And then Medicaid does not approve for the dental implants. That is my short answer. From with the limited exposure that we have to the Medicaid plan, and I can tell you, Medicaid says that you do not need a tooth, and particularly if you are missing one tooth, and if you do not have any other severe medical complication, they are not going to approve you for a dental implant, because Medicaid says that you do not need that extra one tooth to be able to chew. So you are not going to be covered under the Medicaid plan. I can tell you that. And going back to your first comment about being able to afford for the dental implant, the dental implants, we normally say they cost anywhere between about $2,500 up to like about $4,500 or up to $6,000-7,000 if you are going to need some type of advanced bone grafting. So to get a dental implant, if it is going to be in the range of about $2,500 to about $3,000, you can receive those dental implants as low as about $99 per month. And Lynn, you are the specialist and you talk to the patients about dental the payment plans that we have. Can you explain briefly so they can understand?
Yeah, we use a few different banks that we go through for patients to have interest free for certain periods of time. Um, and that helps them fit it into a monthly budget. Like Dr. Vadivel said, you can get them as low as $99 a month, depending on the amount of money that you're requesting from the banks. And we have one company that we use that actually is doesn't require any kind of a credit check or anything. So there are ways to get this done if doing a full payment, in full of 25 to 4,000 is not an option for you. There is ways to get it done where you can fit it into a monthly budget for yourself and make it comfortable for yourself.
Fantastic. I'm going to actually ask you a question related to that.
Okay.
So many a times our patients, when they come in, right? Let's say, I'm just going to role play here.
Okay.
Imagine like I'm a patient here, right? I'm going to ask you a question. Hey, Lynn, I understand that you have payment plans available, but I'm in the process of buying a house and I don't want my credit to be hit. So can you still help me with a payment plan? What is your answer going to be?
My answer is going to be yes. I have an option for you. Yes, I absolutely do.
Yeah. So that is what you are describing as a soft pull, right? Like it is not going to be a hard pull, right?
No,
Or a hard hit, right?
actually, I have one that doesn't hit at all.
Hit at all.
Mm-hmm.
Okay, so
Yeah.
you can get payment plans as if like nobody knows, and you can still get and you can still carry a loan. So I don't have to be worried about if I'm going to buy when I'm going to buy a house or when I'm going to buy a car, they are still not going to hit me with or saying that, oh, somebody hit your credit, so we cannot really help you. So they are not going to say that.
Right. There's
So
absolutely no touch to your credit with the one that I'm talking about. Yes.
absolutely. Okay. So if I understand it correctly, so you have other ways to help or many ways to help patient depending on, of course, the patient needs and
Mm-hmm.
the treatment recommendation. So we have Lynn has multiple ways, and at least at the Tooth HQ office locations we have at the Dallas Fort Worth Metroplex, we have many ways to help patients. And wherever you are, whichever part of the world you are, talk to your dentist and they should be able to help you with multiple affordable payment options they have for your dental implant. And interestingly, now that we have holidays coming,
Mm-hmm.
right? Can you explain to me what a layaway dental plan is?
A layaway dental plan is putting money down on your account, um, monthly payments, weekly payments, whatever fits for you, that you just put the money down until you have enough on your account to be able to pay for the treatment. And then when you have that money built up into your account, then you're able to come in and have the treatment done.
Fantastic. So what I hear you say that is if I'm absolutely concerned about my credit is being hit, and even if you tell me, well, hey, it is a soft hit, and if you don't want to, like, if, even, hey, I don't want any mess ups, anything, nothing whatsoever. So what I hear you say that is I can still put the money down and towards my account, my escrow account, which you're going to keep in your account. Let's say, for example, I'm going to pick a number. If it is $1,000, which is going to cost for my dental treatment, so I can pay you $100 per month until I get that $1,000, and then as soon as I hit that $1,000, and I can come in and get the treatment done. Is that correct?
Absolutely.
Fantastic.
Absolutely.
So what Lynn is saying is, with the holidays coming and Walmart or Amazon, whoever have they have the layaway. So instead of you having to pay For example, like if we have a budget of like about $200-300, you want to get a bigger gift, then you don't have, if you don't have the $300 to pay that in one payment, they have a way to have you pay that either prepay or post pay. So what Lynn is saying is we have a means to help patient for the dental implants. Either you prepay or you post pay, and we still have means to help you. Again, if you happen to be in the Dallas Fort Worth area, come see us at ToothHQ or go see your dentist and talk to them about the multiple payment options they have.
Wonderful. Okay. The next caller says, how much does it cost for 2 dental implants?
Um, so the question is, how much does it cost to have 2 dental implants? I wish I could give you an exact dollar amount, but I really cannot give you a dollar amount without knowing your condition. So I'm going to give you a range. So dental implants cost, like, I see anywhere between 1999, so almost like $2,000, all the way up to $10,000. And why am I saying it's a huge range? So sometime you may have been missing this tooth for a long time. You may need either one bone graft, or you may need 2 bone graft, or you may need a bone graft and a gum graft, depending on your situation. So it may end up costing anywhere between $2,000 to $10,000, or usually it's a range of like about $2,000 to $5,000. I would say in extreme cases it may cost you up to $10,000. Usually it's about 2,000 to about $4,000 or 5,000. So in your case, if you are needing 2 dental implants, and I'm going to say possibly anywhere between about 4,000 to up to maybe about $8,000 to $10,000. That's what my guess would be. Yeah.
That's a pretty good guess.
Yeah.
That's what a pretty good guess. Going doing that every day at ICC people
Absolutely. Yeah.
that do
Correct.
that.
Yeah.
So
Absolutely.
absolutely. All right. The next caller is asking, what is the duration of the implant procedure, and do you offer veneers as well?
So the question is, what is the duration of the implant procedure, and do you offer veneers as well? So I'm assuming what the caller may be asking is whether they are talking about a crown attached to the implant, they are calling it as a veneer, or they are talking about a veneer in addition to replacing a missing tooth, possibly in the back. So I'm going to assume, I'm going to answer both. So the question is on what is the duration of the procedure, and we call it as a same day dental implant. What that means is, and let's say if we have a missing tooth, we are able to place the dental implant and possibly a crown even on the same day, or we are able to give you a missing tooth in the form of a tray. So it is a same day dental implant if you have a missing tooth. If you have a broken tooth, we are able to remove the tooth and place the dental implant and possibly give you the crown on the same day, or possibly give you the tray on the same day. So again, it is a same day dental implant. If you're looking for a crown, like I said, we will place the temporary crown on the same day, but once the bone completely heals around the implant, which usually takes about 8 to 12 weeks, then you will be receiving a final crown or the final tooth on the implant. If you are referring to veneers, if that is what you are referring to as veneers, as I said, you will receive the temporary veneer on the same day or within the same week of the dental implant, and you will receive the final veneer in about 8 to 12 weeks after the procedure. If you are talking about veneers to complement your smile when you are receiving a dental implant on a back tooth or another tooth, then those veneers can be done as well. And as you guys might know, we are a dental specialist and we offer only the surgical services at our ToothHQ dental offices, and we do not do a straightforward dental treatment. Of course, we have many dentists, and we have hundreds of dentists that those are referring patients to us, and we can absolutely find a dentist who is closer to the area, who you are comfortable with, and we can do a personality match to your personality, who we think could be a best dentist for your needs, and we will be happy to refer you back to a dentist in the area for you. And if you happen to be in an area that you are working with another specialist, and talk to them, and they should be able to find a dentist for you because they know who is the best for you, your needs.
Great. Okay, um, so just to reiterate what you just said, the we do the implants here in our office because we're a specialist, and um, the general dentist, the family dentist we work with would do the final restorations, whether it's the crown or veneers.
Absolutely correct. Yeah,
Okay.
correct. And if they happen to be in any other parts of the world or any
Mm-hmm.
other parts of the country, particularly in the US, and if they are going to end up going to a specialist, and if they don't have a facility to offer the restoration in their office, and they should be able to find a family dentist to work with.
Very good. All right. So our next caller is somebody who says, "I'm 53 years old, and I had my last bottom wisdom tooth removed 3 weeks ago. I've been experiencing severe discomfort from my wisdom tooth extraction for the past 3 weeks, and it hasn't improved. I've lost sensation in my bottom teeth, and the pain in my chin is excruciating. Nothing seems to alleviate the pain, and it's causing me to feel depressed and frustrated. Additionally, I've developed a sore on the inside of the bottom of my lip due to the trauma. What can I do to manage the pain and soothe the nerve? Will I require surgery to address the issue?"
So, so it is a really long question, and to summarize this, and I can only I'm going to say that the scholar is experiencing a lot of pain following a wisdom tooth extraction, and she also has received some trauma or some kind of a burn to the lip, and also she's also experiencing some type of loss of sensation on the lip or the tongue following the procedure. So it is a three-part question. The simple thing is the trauma that you may have on the lip. If it is related to what we call it as retracting or pulling your lip during the procedure, and more than likely it is going to resolve, and it may take up to maybe about 4 to 6 weeks or up to 8 weeks or a few months, and I'm hoping that it is going to completely resolve. To address your immediate concern, which is the pain that you are experiencing, and whether you are going to need any type of surgery. And if it is a simple, what we call it as a most of the time, the pain that you are experiencing, it could be as simple as what we call it as a dry socket. You may not need a surgery. It could be as simple as you may need a prescription for an antibiotic, or you could be needing a prescription for a pain medication, or maybe even a stronger pain medication that could take care of the issue. Whether you are going to need a surgery or not, I want to say you don't need a surgery, but sometimes the best possible option for you to what we call it as a debridement surgery. What it involves is it could be as simple as giving you some type of numbing, and then we open up the gum, the surgical site, and we what we call it as a cleanup. It could be related to some kind of a food getting stuck in the area, which could be causing irritation to the bone, or you may be a smoker, or you may have used a straw accidentally. That may have caused what we call it as a dry socket. So it may involve opening up the gum tissue and cleaning it out and induce some fresh bleeding, which is going to take care of the pain. So it could be as simple as, and although it is a surgical procedure, it could be simple, and we do this procedures several times during the month, and it could be like a 10, 15, 30-minute procedure, as simple as that. And to answer your third question, is your nerve damage. Looks like you lost some sensation in your mouth. If it is a tongue or the lip, which is the most common site after the following an extraction, and most of the time it should resolve. And again, talk to your dentist, and we do treatment as simple as giving some vitamins, or giving you some steroids following the procedure to take care of the issue that you are experiencing, which is the numbness. And I would be concerned only if your numbness is not going to go away several weeks after the procedure. We normally wait for about 6 to 8 weeks, and then if the numbness does not resolve, then we take further actions. And so, depending on where you are in the journey of the recovery, talk to your dentist, and they should be able to help you. If you happen to be in a surgeon's office, again, they should be able to follow the protocol of giving you the medication, and if the numbness does not resolve, then they can initiate further referral for you to a neurologist or microneurosurgeon, and that should be the course of action for all the problems that you're experiencing.
Awesome. Thank you for answering that question. Um, so our next question from our callers is, do you offer tooth extractions, and how much does the extraction procedure cost?
So, do we offer tooth extractions, and how much does an extraction cost? So, absolutely, we are ToothHQ dental specialist, and we have many locations in the Metroplex, and that is what we do day in and day out. And I've been doing wisdom teeth extractions for the last about almost 30 years, and we would love to help you. And we are not just wisdom teeth extractions and any type of extractions or oral surgery for the last about 30 years, and we would be happy to help you. So going back to your absolute question is, which is what is the cost of the procedure? So depending on the type of extraction that you are going to need, it could be as simple as a couple of $100, or it could be several $100. And the reason for the different type of the fee is, if it is a simple extraction, which could be as simple as, we are just going to I'm going to call it as a magically gently elevating the tooth, and which is going to be a simple extraction, which is going to be a couple of $100. And sometimes if your tooth is impacted, which means if it is stuck inside the jawbone or stuck under the gum line, it could end up being like about $400 to $600 about for the procedure. And also, not just a tooth extraction, sometimes to make it comfortable for you, many a times we also offer sedation, not just in our office, and anytime, anyway, in whichever part of the world you are in, they are going to help you with several types of sedation that they offer, which could be as simple as what we call it as a laughing gas or the nitrous oxide, or oral sedation where you take a pill, or we put you to sleep either with IV sedation or a deep sedation. That could be adding cost to your extraction also. So whoever you are talking to, and if you happen to be in the Dallas Fort Worth area, come visit us at Tooth HQ, and we'll be absolutely thrilled to give you an estimate for you at absolutely no cost, with the free consultation and the free CT scan we offer. But if you happen to be in any part of the world or in any part of the U.S., talk to your dentist, and they should be able to look at your tooth, do the necessary investigation, including an X-ray or a CBCT scan, to give you an estimate of what is the cost of the dental extraction.
Wonderful. And it varies a lot between the simple extraction and the very surgical extractions
Or an
on
impacted tooth.
the impacted tooth. Yes, and patients do really love to be sedated most of the time.
Absolutely correct. Yeah, right.
All right.
And we
So
say them, see you at the La La Land, right?
yeah,
Yeah. So let them
absolutely,
be in the La La Land, and
absolutely.
let us do the work, and you stay at the La La Land, and we will do the work, and then we'll bring you back to the real world after we are done at the La La Land there. Yeah.
All right. So our next caller is asking, what can I do to address dry mouth issues and prevent cavities? I need to find an affordable dentist, but I'm not sure how to go about it.
So, what the caller is asking is, they are experiencing some kind of a dry mouth, and how to prevent the dry mouth, and also the caller wants to prevent dental cavities, because which is one of the most common things that happen because of the dry mouth. And sounds like, you may have some problem with finding a dentist. So my recommendations, the second part of the question, how to find a dentist. There are so many dentists available, whichever part of the world you are in, and ask, now I call it Dr. Google, ask Dr. Google and find a dentist that you trust from the reviews you may read or the expertise that they may have. Or if you happen to be in the in the Dallas Fort Worth area, come see us and we can definitely help you. And in the US, we you can call the dental society or call the dental board, and then they should be able to help you find a good dentist. And how to find a dentist who you can afford. Again, whichever dentist that you are calling, ask them whether they offer any type of payment plans. And for example, one of the most commonly available dental payment plan or a dental credit card is what we call it as a care credit. So if you go to the care credit website and put in your zip code, and then you should be able to find a dentist who is able to offer that type of payment plan. There are several payment options available like care credit or get basis or moment or sunbit. So any website that you go to, put in your zip code, you will be able to find one of those providers. And then to answer your first part of the question, which is
What can they do?
um,
The dry mouth?
oh, to prevent the dry mouth. Uh, so it could be as simple as we are going to give you a stronger toothpaste, which is to prevent cavities, which is a prescription toothpaste we give you. Or before you even go to the dentist, you could be using products as simple as what we call it as a biotine. It is offered. Biotine offers a variety of products for people who are experiencing dry mouth. You could be using a variety of things, and then you could be using the range of products offered by Biotene, Biotene, Biotene type of products, which are being exclusively offered for people who are experiencing dry mouth, and could be as simple as some home remedies as sucking on an ice cube or chewing on a sugar-free gum. Make sure, underline sugar-free gum. I don't want you to chew on a sugared gum, particularly when you're experiencing dry mouth and you don't want to get cavities from the sugar-free gum. And so don't over chew because you will end up having some jaw issues by over chewing the gum. So you can suck on some ice cubes, drink a lot of water, and a sugar-free gum. Those are my recommendations.
Very good recommendations. All right, so the next caller says, do I require dental implants? I currently have dentures and a partial for the lower jaw, but I can't wear them and they make me feel unwell and I struggle to eat with them.
Sounds like this caller is experiencing some trouble with the denture that they have, and then a partial denture they have, either the top or the bottom, it doesn't matter, a complete denture or a partial denture, and and they have inability to eat with them and inability to speak with them, and more than likely they are losing some confidence. And you pretty much answered your own questions. And you have a denture, you have a partial denture, you can't eat well, and you cannot speak well, you are losing some confidence. And this is what we say, as Lynn said earlier, go Nike, just do it, right? So you definitely need the dental implant. Dental
Yep.
implants can help you eat better and speak better and gain the confidence. And you're going to say something, Lynn.
They just make you feel better about yourself. They give you that like you said, the confidence. And we have multiple ways of restoring um, people that wear dentures, restoring them with the implants that they don't even, one way is to, they don't even take it out of their mouth. It's always there, just like your natural teeth. And then we have some that go in and out, but stay better than the ones that aren't attached.
Absolutely. This is what we say about dental implant. They look, feel, and function like a natural teeth. So if you're looking for an option that's just going to look, feel, and function like natural teeth, go Nike. Just do
Just do
it.
it.
Dental implant. the way to go.
All right. Thank you for that, Dr. Vadivel. All right. So our next caller has said, I have cavities, doctor. What should the next course of action be?
So the next caller is asking, I have cavities, doctor. What do I need to do? Uh, Simple answer, go see the dentist, right? And again, we call it as go Nike, just do it, right? So you just got to go see the dentist, and depending on the type of cavities that you may have, and if you are going to go early, which is critical, just don't wait for another 3 months, 6 months, and another year. If you are going to see the dentist, it could be as simple as they are going to brush your teeth, and we call it as brushing your teeth with a varnish. It could be as simple as that. If you end up waiting, and you may end up needing a filling, or you may end up needing a crown, or you may end up needing to even remove the tooth. So just don't wait. Go see the dentist now. We say now, right? So you got to go see them now so you can prevent any type of future problems, and to prevent cavities, and either from getting bigger or absolutely take care of it.
That's right. Be proactive and not reactive.
Absolutely.
So,
Exactly right.
all right. All right. So, our next caller says, Hi, Dr. Vadivel. My 21-year-old son needs to have his wisdom teeth extracted. Interestingly, I, as his mother, never had mine removed. I apologize for the confusion, but we are located in the Dallas Fort Worth area. I am looking for an affordable dentist for wisdom teeth extraction and deep cleaning services in the Metroplex.
Fantastic. So this caller has a 21-year-old who still has a wisdom teeth, and apparently mom never had the wisdom teeth removed,
Mm-hmm.
so they are looking for the wisdom teeth removal and the deep cleaning services, and absolutely we do it every day. This is what I've been doing for the last about 30 years. If you happen to be in the Dallas Fort Worth area, and sounds like you are, and come see us, we got multiple locations. We'll be happy to see you. To answer your question on, and should your son have your wisdom teeth removed, the absolutely you should have them removed. And sounds like you are a young mother, and you definitely should consider possibly having the wisdom teeth removed also, even though
Mm-hmm.
you have not been told. And Lynn, you know that, like, we have um, patients all the way ranging from 16 years all the way to 60 or even
Absolutely.
older. They are still going to need the wisdom teeth to be removed. So because you sound like a young mother, and if you have any problems associated with the wisdom teeth and sound like you are in the Dallas Fort Worth area, definitely and come on a dating with your son here, and we'll be happy to see mom and the son on the same visit to give our recommendations, and we'll be happy to help you.
Absolutely.
And think speaking of the dating, how many times we have the mom and the daughter, or the
The
son
mom
and
and the
the daughter,
husband.
or the husband and the wife
Yep.
coming here. Tell them about
We
it.
do. We have whole families come sometimes, mom, son, mom, daughter, daughter, dad,
Kissing link.
son. Um,
Kissing link brochure. Yeah.
so we have patients that come in all the time together and see us so that they can it saves time for them because they're both being seen at the same time. So it's kind of a 2-for-1 special there.
Absolutely. So speaking of that, like, that brings in, I know it is not part of the questionnaire here. So I want you to, many times when we have a husband and a wife, for example,
Mm-hmm.
right? So the wife came as a patient. The husband is not a patient, but many times we recommend about the mouth body
Mm-hmm.
connection and the kissing link,
Uh-huh.
right? So do you want to tell them, let's say let's say my wife came as a patient and
Mm-hmm.
I was the husband. I came with with my wife. So tell me, what are you going to explain how it is critical for me to get a consultation also? What are you going to
Okay.
tell my wife?
Well, I would tell your wife that if you could see this, I don't know if you could see this very well, but for a healthy tooth, the gums are nice and pink and tight against the tooth, and so is the bone, as you can see in this picture right here. And then when you have an unhealthy tooth and there's bacteria and infection in your mouth, the gums are more red and puffy, and the bone is not as tight up against the tooth. That is an infection in your mouth. And when you have that infection in your mouth, it doesn't just stay in your mouth. It gets into your carotid artery and it goes to your heart, your lungs, your liver, your pancreas, your brain. For women, it can cause pregnancy complications, stillbirths, low birth weights, and other pregnancy complications. And then for men, it can cause erectile dysfunction. And it's not only something that affects you in your own mouth and in your own body, but you can transmit this to your spouse, your children, anyone that you are kissing, anyone that you are sharing utensils with, or even just coughing and sneezing around them sometimes can do the same thing. So if you have periodontal disease, it is important to have your whole family checked.
Fantastic. So what we call it as a mouth-body connection, or what we call it as a kissing link. So think of this, guys. So periodontal disease or the gum disease, it is caused by the bacteria. It is a bacterial disease. So depending on the severity of the gum disease, you may have a little bit of bacteria or you have a ton of bacteria. So when you have a ton of bacteria, then it is easy for you to spread the disease and to your spouse and the significant other and your family. So if somebody has gum disease in your family, or your husband or the wife or the significant other, if you have a relation with them, it is absolutely critical for you to get checked
Absolutely.
for gum disease. Yeah. So again, if you're in the Dallas Fort Worth area, come see us. We'll be happy to help you. And this
Yes,
is
we
what we
will.
do day in and day out.
Absolutely. Um, so the next question is, I require information regarding the removal of a molar tooth and its associated cost. So yeah, an extraction and the cost of that. So I think we've
I think so what the caller is asking is, what is the cost associated with an extraction? Um, I wish again I could diagnose over the phone or diagnose over the internet what type of teeth that you have. Sometime, people ask us all the time, hey, why can't you just do teledentistry, right? And because that is what they are possibly used
mm-hmm.
to doing with the doctor and with their doctor when they have a cough or cold, and they are doing a telemedicine visit with the doctor or their nurse, and they are getting medications over the phone, and they ask me all the time, oh, why can't you just do teledentistry? I wish I could jump into your mouth, see under. Even if I jump into your mouth, I still can't see some of the teeth. But sometimes the wisdom teeth are like deeply impacted in the jawbone. Sometimes we can only see the wisdom teeth only on the x-ray or the
Mm-hmm.
CT scan that we take. So as I said, I can jump into your mouth, but I still can't see your teeth, and I can only see them on the x-ray. So we always put the two and two together. We look at you and we look into your mouth and we talk to you about the problems that you have, and then after we do this, then we do a CAT scan in our office, and after we look at the CAT scan, we diagnose on the CT scan or the CAT scan, and we put the two and two together and we make the recommendation. So going back to your question, depending on what type of extraction that you need, whether you need any type of bone grafting following the extraction, whether you're going to need a dental implant following that extraction, or you have impacted wisdom teeth that we cannot even see inside the mouth. So depending on, and whether you need to be put to sleep to make you
Mm-hmm.
comfortable, whether we need to send you to the la la land during the extraction. So the cost of the extraction could differ, and it could be as simple as a couple of $100. It could go all the way up to a couple of $1,000. Again, if you happen to be in the Dallas Fort Worth area, come see us at ToothHQ, and we can definitely help you, or talk to your dentist or the surgeon who can help you with an extraction. They should be able to help you.
Great. All right, so our next question is a person who is missing 4 teeth, and they are wanting the pricing for dental implants that everyone has been talking about.
So again, this caller is asking what is the price of the dental implant. I'm missing 4 teeth. Um, so depending on where your 4 teeth are, the treatment is going to differ. Again, uh, had I had the information where these teeth are, whether it is in the front of the mouth or in the back of the mouth, the treatment plan is going to differ. Again, I wish I could diagnose over the phone, or I can diagnose over the internet. Even if you happen to be in front of me, I still can't diagnose because I really don't know what your bone is going to look like. So for that, even when you come to the dental office, we do what we call it as a CAT scan to be able to complement our clinical exam, and then we put the two and two together. Again, depending on the where you are missing teeth, whether it is in the back or the front, whether you are going to need any type of bone grafting prior to the dental implant or at the time of the dental implant, the cost of the implant is going to differ. Um, we have had multiple calls today regarding the cost of the dental implant. It could be as simple as a couple of $1,000 per dental implant or per tooth, all the way up to $4,000 or $5,000 per tooth. So particularly if you are missing 4 teeth, it could be as minimal as you are going to need 2 implants and a 4 teeth on the top, or you may need 3 implants and you can have 4 teeth on the top of that. And I'm going to say a huge range, anywhere between maybe about $6,000 to $8,000, all the way up to maybe about $15,000 for all 4 teeth you are going to need. If you happen to be in the Dallas Fort Worth area, come see us, and at absolutely no cost, we can give you an estimate. And wherever you are, go talk to a dentist, and they should be able to help you.
Wonderful. I'm going to ask you a question. I was just thinking of that. Um, for dental implants, doesn't your medical history play a part in whether you're a good candidate for implants?
Great question. What Lynn is asking is whether your medical history plays a part in your treatment, whether you are a good candidate for a dental implant or not. So just before walking in here, I saw a patient this morning in my office. This patient has gone through radiation and chemotherapy, and that too, they had gone through the chemotherapy and the radiation very recently because of a throat cancer. So that patient is going to need a tooth extraction, but the tooth extraction is not immediate, meaning it can wait. So what I told them is, you are not a good candidate for even an extraction.
Mm-hmm.
They have multiple missing teeth in their mouth, and I told them, you are not even a candidate for extraction. Forget about dental implant. So this is one of the examples. Chemotherapy or radiation is one of the examples patients cannot receive dental implant. One other contraindication is patients who are receiving medication for osteoporosis. Many women
Mm-hmm.
are suffering osteoporosis. Many of you guys watching tonight may be receiving some medications or treatment for osteoporosis, and you may not be a good candidate for a dental implant. I'm not making a blanket statement. If you have osteoporosis or osteopenia, you are not a good candidate. Many people, depending on the severity of the osteoporosis or the severity of the medical condition,
Mm-hmm.
they may not be a good candidate. Even patients who had cancer treatment or they had a chemotherapy or a radiation, we can still make them a candidate. But these are some of the most common contraindications for dental implant, and depending on the wherever they are in their journey of recovery, we can make them a candidate for
Mm-hmm.
dental implants.
And along with that, patients that smoke are That's a contraindication for dental implants as well for the longevity of them, isn't it?
So great question. What Lynn is asking is smoking a contraindication? So there is a difference between contraindication means you cannot absolutely receive a dental implant as opposed to you are a high risk candidate. So for those patients who are receiving dental, who are smoking, they are a little bit higher risk candidate for dental implant as opposed to somebody who is not smoking. For somebody who had cancer, that's a different story. That's a contraindication. They cannot receive the dental implant at all for a certain period of time, period. But for somebody who's smoking, we do implants
Mm-hmm.
all the time, but we tell them, and I do have an obligation to tell them, hey, relative and compared to somebody who is not smoking, you are slightly at a higher risk, or somebody who is smoking 2 packs a day and they are even at a higher risk of losing those dental implants or having some complication following. So again, great question. For somebody who is a smoker, they may not, it is not that they are the implants are contraindicated, but depending on how much they smoke,
They're
they
at a
may
higher
be at a
risk.
higher risk of receiving those dental implants. Yeah.
Wonderful. I think
Yeah.
we're out of time.
All right. Thank you, everybody, and thank you for joining us for another episode. And we look forward to seeing you the next time. Thank you so
Thank you
much.
so much.